Tonight, nurse practitioners and physician assistants are joining the battle against the heroin epidemic. They took part in one of the first training sessions in the mountains to use a drug to treat opioid addiction. News 13's Tanja Reiki was at that training center at the MAHEC, and Tanja joins us now. And how do they think this can help?
Frank, they tell me that oftentimes doctors are so busy that patients only have the option of seeing nurse practitioners or physician's assistants. And because doctors are not there and are not able to prescribe buprenorphine, patients sometimes don't get access to potentially life-saving medication. A little bit about the drug: it is an opioid, but advocates argue that it's safer than methadone and say when combined with counseling, it can really help addicts into recovery. Nurses and physician's assistants were able to start part 1 of training in November after the Comprehensive Addiction and Recovery Act was signed by President Obama. And once they completed that part, they were then given the go-ahead to come to trainings like the one that took place for the first time this year.
The opportunity for NPs and PAs to be able to prescribe is also huge because how our healthcare system has changed and how many NPs and PAs are really helping physicians in more of the rural areas where access to buprenorphine is even more sparse than here in town.
Some people who've been addicted to opiates never feel good again. They never feel good again. Their quality of life is terrible. And those people can, given something like buprenorphine, which is much easier and really safer than methadone, they can get their quality of life back.
More education, and brought up a good point, like not just.
MAHEC will be hosting another training in the summer, sometime in June, and NPs and PAs won't be able to prescribe the drug until they complete the training sometime in the summer as well. And according to the law, they will be able to do so for the next 5 years. Live in Asheville, Tanja Reiki, News 13.